posted a few weeks ago that I regularly foam roll. I had a few of you reach out and ask for a foam rolling video. So I asked my friend and physiotherapist Ryan, and the owner of Limitless Bronte, if he would take us through a full body foam rolling session. So Ryan, what is foam rolling and why should we do it?
Okay, so foam rolling is obviously using a foam roller, and it is a myofascial technique or a self-myofascial release technique. Myofascial release is essentially the technique that physios or massage therapists use when they do sort of slow sweeping movements along your tissue, and it's to promote flexibility, circulation, and in some cases break up scar tissue or adhesions through the fascia. So why you do it? All your muscles are sort of coated in fascia and they're connected to each other by fascia. So you might have heard of myofascial slings in some training, so you've got different muscles in different parts of your body and it's connected by fascia. And so the fascia is supposed to be quite stiff and tight so that when you contract different muscles in different parts of the body, it sort of creates that sling, creates stability and provides power when you're trying to move your body. So the rolling technique is a good way to do it yourself to sort of promote flexibility, circulation, which we'll go through some other benefits of it throughout the session.
Alrighty, let's get started.
Alright, so I thought we'd just start at the bottom of the body, so we'll start with our feet. Amy's going to use the roll for this. I actually use a trigger point ball more for this. So if you're standing up, put the ball on the floor or the roller on the floor, and we'll just put that down gently. Don't go too hard, it's quite a sensitive area, and you can just roll back and forward very slowly. When you're doing myofascial release, you're supposed to move from proximal part of the muscle or the tissue and then move distally along it quite slowly, and you can do it in small little kneading sort of type movements. It shouldn't be very fast, it's a quite slow technique. What we'll do today is we'll probably do about 30 seconds on each side, but in normal practice I'd probably get people to do a variety of lengths depending on how tight you are, but somewhere between 1 and 5 minutes, and probably the average is to do 2 sets of 1 minute each muscle group. So we'll swap to the other side. It can be quite sore under there, nice sore.
Mm-hmm. Yeah, the ball is definitely more intense if you have a ball at home. What kind of ball can you use, Ryan?
You can use a lacrosse ball. We use these sort of hard rubber trigger point balls for that purpose. Some people with plantar fasciitis might use golf balls if they're really tight. For plantar fascia, you can even use a frozen water bottle if you want a bit of relieving coolness under there as well at the same time. And then there's other big spiky balls as well. Depends on your preference really and how small and accurate on the pressure.
What kind of roller should we use?
So there's 3 types of rollers generally. This one is a solid foam and quite smooth. That's what we use in the clinic a lot, purely because we don't just do myofascial release, we do some stability work as well. We might move down to our calves now. If you're new to rolling, this one's a little bit more gentle. It's a little bit softer, and you can also use for other things like laying on it, doing stability exercises. It's quite comfortable to lay on. When you're doing your calves, you can do the bottom half of the calf to hit your soleus, and then you can move further up into the top of the calf to hit your gastroc. If that's not enough pressure for you, you just simply cross the leg over the other one, and then you can get a bit more weight through the calf, which is a little bit more
intense.
A bit more painful. And if you know that you're tight on the inside of the calf, you can just roll your foot into the inside, hit the medial head of the gastroc, work on that slowly through the muscle, and then you can go onto the outside of the muscle as well. The second type of roller is a hollow, firm base sort of roller. So you've probably seen in the hollow, obviously, they've got a hard plastic inner and then a little bit of foam on the outside. They're much harder, so you'll get more intense pressure. We'll swap over. And it gets a deeper release, and I guess if you're sort of had a bit of experience with rolling or you know that you need that extra pressure, that's what you'd go for. And then the third type are the ones with the lumps and bumps on them. Mm-hmm. And the lumps and the bumps just concentrate the pressure over a smaller area. So it sort of simulates the trigger point ball, and it's sort of more similar to using that or when a physio puts their elbow in your hip, it's something like that. So it's for the sadists or the people that are very, very tight. Alright, so then we can go up into your hamstrings. Just be careful when you move it. You don't want to roll the back of your knee or sort of on the joint, so just move it above your knee slightly. Same principle, you can just go slowly through the muscle. And if that's enough pressure for you, if you're quite tight through there or it's quite sensitive area for you, just sort of go just below the buttock crease and then back forward down that way. Now you can do long sweeping movements, or you can just sort of oscillate slightly as you move up. And if you find a particularly sore or tight bit, you can then just work a little bit longer into that area. And then similarly as the calf, you can cross your leg for more pressure.
Now, should we be doing this before or after we exercise?
Depending on what you're trying to achieve. So if you're doing it before, I guess the big benefit of rolling or myofascial release in general is it's been shown that it can improve flexibility without impairing muscular performance immediately after. So it's a really good way to, before you exercise, do a little bit of rolling and then some dynamic stretches, which I think you've done on one of your running videos. That would be a really good way to do pre-exercise rolling. Whereas if you want to use it after, static stretches and rolling used together will actually get a better result for flexibility instead of just using stretching or rolling in isolation. So when you're finished, you'd probably do a bit of rolling, a bit of static stretching. There's a little bit of anecdotal evidence out there that it can decrease DOMS, which is the muscle soreness you get the day or so after exercise. I think that's more about that it can increase circulation, so it can just aid a bit of recovery after. Now from there, usually go up into your glutes. So usually do one at a time, just cross one of the legs. This is Amy's least favourite, I think. And then just slowly go through. Just be careful here, there's obviously bones, you've got your bursa on the side of your hip. You just want to make sure you're in the muscle, you're not sort of rolling over a bone. And you've also got your sciatic nerve that runs through there. So if you feel anything tingling down your leg or anything like a burning sensation, you definitely want to get off that point and just be a little bit more gentle with what you're doing.
And is this the same thing with the calves? Can we kind of roll a little bit to side, or are we just going...
Exactly, yeah. You just sort of move around until you find that there's a really tight band in my glute just there, and you just sort of knead that area until it relaxes. Like I said, everyone will be a little bit different, so you may need more in the glutes and you might need much in your calf, just depends on your body.
So how often, or I guess how long should we be doing this for, and how often?
Usually how long varies on, again, like how tight you are, but a general rule is I usually get people to start out trying to do about a minute, maybe having a rest, then 2 sets of a minute on each muscle group. Obviously the people that I see, sometimes they've got a specific injury, so they might only be just doing their ITB in their calf or something like that. And then how often through the week, it sort of depends on your body type. So if you're, I know you see a lot of yoga people, so hypermobile people or super flexy people, they may not need to roll very often. Like I said before, your fascia, it's supposed to be stiff to sort of provide sort of stability between the slings, so you don't want to be making yourself excessively loose. If you're hypermobile, it can make you a bit sort of floppy. Whereas if you're the other end of the spectrum and or you're training for a marathon and lots of running, then you could potentially do it every day, or up to a few times a week. And but I'd just be careful. Like you sort of got to work out why you're rolling. You don't want to be too aggressive to the point you're causing pain, but a lot of the time if you're finding that you're having to roll your hamstrings every day, there's usually a reason why the hamstrings are getting tight. So it might be weak glutes, it might be weak core stability. So if you can identify the cause of, I guess, the problem rather than just rolling the symptom, then you should eventually find that you don't need to roll as much.
Right.
Alright, so then you roll over onto another least favourite is your TFL. Now, quite often I'll use the ball from the TFL, so I might demonstrate that, and you can just demonstrate the roller. If you're doing it on the ball, you just lay straight on your tummy and put the ball next to you like that, and then just roll onto the side, kick your leg out, and it is quite intense. If that's too much, you can do what Amy's doing and using the roller in the TFL. If you've got a trigger point ball, you just hold the pressure until the pain starts to ease off by about 30%. Might take anywhere between 30 seconds and a minute. Sometimes it's okay to get a little bit of a vague sort of referral pain down the outside of your calf. That means you're on a pretty active trigger point in your TFL. That's okay, it's not a nerve you're hitting. And just as that eases, then you can change spots.
And is there, because I know some of these, especially through my TFL and my hip flexors, I know I feel, quite a bit of discomfort. Is there like a level when we know we should stop?
Yeah, you don't want to ever feel any burning, and obviously just sort of moderate the pressure. So if I'm on the ball here, I can use my arms and this knee to sort of take a bit of the weight off the ball. So just make it shouldn't be complete agony. It should be a little bit enjoyable. Most people, once they do it for a little while, they actually feel like they start enjoying it because they feel the relief after. But as long as you're not feeling any sort of burning or referral pain that's like nerve type pain, pain, then you should be okay. Just avoid bony prominences, and you don't really want to be on the actual tendon where it inserts onto the joint. Alright, from there we can go up into our ITV.
This is actually my least favourite.
Now, what I would probably suggest to start with is you put your other foot up close to the roller, you put both hands on the ground, and then you can at least take some weight out of the roller if it's quite sore, and then just basically go down through the front corner of the ITV, or the thigh, and then if you know that you need a little bit more pressure to that, you can take the other foot off and then go through it like that. There's a common misconception with ITV rolling that you're changing the length of the ITV. That's actually not the case. You can't really change the length of fascia, you can just change the flexibility of the muscles that are attaching into it. So if I sort of get people that just roll their ITV, I'll quickly get them to change to doing your TFL and your glute first, and then go down to the ITV. There's a muscle that sort of lies under the ITV called your vastus lateralis, or your VL, and if you can decrease the tension in that, it can sort of decrease the pressure or the tightness of the ITV. And again, you want to go down close to the knee, but you don't want to be going anywhere near the kneecap. It shouldn't be touching bone when you're doing this. Alright, now from there, we can just go onto our quads. Same rule applies, you can do 2 quads, you can do 1 quad. Just go into almost like a plank position, and then just rolling down, like that. Now, that's not enough pressure for me, so then I would put one leg across the other one. And again, you can sort of go through the front of the quad, you can slowly go onto the outside, and that'll hit that lateral quad muscle that I was talking about. And as it releases, if you want to sort of continue, try to get more flexibility, you can bend your knees. And that'll be much more intense.
This is a cool workout as well.
Yeah, you get a nice ab workout.
Bonus content.
How's that?
Yeah, this is good. I'm definitely quad dominant in IT bend. Always need some love through the front of the thighs.
Now, if you want to stay on any of these points, just pause the video and obviously stay there and give yourself as much time as you need. But we're just going to do about 30 seconds of each one.
And then from here, do we make our way back to the IT band on the other side?
Yeah, exactly. So then you just roll across and then you go on to the other one. Actually, I already did that one. So I'll go this way.
And if we do want to stop on a point that feels a little bit like it needs more, do we kind of just rest the foam roller there, or do we roll the foam roller a little bit up and down to help release?
So you can do both. If you put sustained pressure, it's like active pressure. It's like if someone pushes their thumb and holds the pressure on you, and then you may feel it release. If that's too strong, you just sort of knee back and forth, just over an inch or so, and just slowly work through that area till it releases. And if you've had previous muscle tears or you've had some injuries around your hip or your knee, you may find some adhesions through there which do feel quite specific tight areas, and it's a good idea just to knead them and try to loosen them up. Okay. Alright.
Up into the TFL next?
Yeah, TFL on that side, yeah. Oh, this one's worse.
It's good to know that even a physio has tight spots.
Physios always have tight spots. We're terrible at treating ourselves. Good at telling other people what to do.
Now, if I've been sitting down at my desk all day, what should I focus on if I only have 10 to 15 minutes?
So if you've been sitting, you definitely want to hit the TFLs. Your quads, they're all going to be in a shortened position when you're sitting. And then you'd probably then follow it up with some hip flexor stretches, some quad stretches. And then we'll move on to some thoracic spine things at the moment. If you're sitting at a desk a lot, you really want to decompress your thoracic spine. And so that would be a good option too, as well.
Seems like a good segue.
Yeah. So we'll move up into the upper body now. So again, you don't want to be in the bony points of the pelvis. Now this point can be quite uncomfortable for some people as well. So we're going to do our lats and then we're going to move up into our rotator cuff area. So just be careful, put your elbow down first and then just slowly lower the pressure of the roller onto your lats, which are on your ribs. And then just move in and out. You might go to do the whole length of this because it's a little bit awkward. So just sort of work on one section first. And this is a common area for people sitting at a desk to get compressed. It's an area that anyone who's working with their hands a lot, I get quite tight for this area regularly, so I'm on this pretty much every day for this area.
So am I going all the way out towards the armpit?
So for your lats, you sort of just go to the border of your scapula, and then once you want to get into the cuff area, you sort of go onto the edge of the scapula. You'll feel the bony part of the scapula there. If you roll slightly back, you'll be just starting to work through your rotator cuff. So there's muscles in there like your teres minor, your infraspinatus, and that's a really good area to loosen up, sort of decompress the upper part of your thoracic spine and also around your scapula, which can help with increasing shoulder range of motion and also thoracic rotation. I quite often use the trigger point ball here as well, which I've lost, but you basically place the ball same spot under your arm like that, and then it'll be much more intense, so just be careful how much pressure you put down onto it, and then just lay into it and just support your head with the pillow or your hand like that. Okay, that's good. Okay, other side. Again, lower down gently. Dump yourself onto your ribs there. And just move up and down slowly. If you do have any neck issues and if you don't like holding your head up in there like this, you can just put a pillow on top of your shoulder here just to support you, or you can put the other hand there like that. Is that tight for you?
Yeah.
Yeah, especially my calves really tight.
This is my down dog muscles coming into effect.
That's good. Alright, so that's the side of your thoracic spine. What I'd probably finish off with is I'd put the roller lengthways and then just lay up and just sit right on the end of it. Lay back carefully and just try to make sure your head lands on the roller so your head doesn't fall off the end. And then you can just open your arms up. Just be careful if you've got any shoulder problems with this, but if you don't, you can actually lay them out in a T position like that, or you can actually have them out lengthways if you've got enough room. And you should just feel a nice stretching through your pecs, just opening up of your chest.
And if you only have a short roller, can you still use this sort of just along the length of your back with your hips on the ground, or is...
Yeah, you can do that, and you'll also get a bit of thoracic extension then, or you can put something like another bolster under your pelvis if you want that pressure. We'll do it across the back in a minute as well, so we get looking for sort of thoracic extension as well. So it's nice to open this up first with your spine supported, and then you'll go for the extension.
I think I could stay like this all day.
Yeah, it's nice.
It's really nice.
I mean, in the clinic we use this to layer and do some stability work through like leg lifts and arm drop ups as well, so it's quite versatile in this position for core stability. That's good. When you're doing any thoracic areas, it's good to make sure you can continue breathing. If you don't want to be holding your breath in these techniques, because your ribs will sort of compress. So just take nice deep breaths when you're in a relaxed position, and that will help to expand the muscles between your rib cage and help just to decompress the area and improve your breathing. If you can decompress your rib cage, your breathing should improve as well. Okay, so then sit up carefully, or you can roll to the side, whatever you prefer, and then you put the roller back crossways. I don't tend to roll the lumbar spine, I don't think it's that effective. I'll probably just stay through the thoracic. So when you're doing this, just make sure you're supporting your neck. You don't want to be pulling it up with your hands, but just support it. Lift your bum off the ground and you just go through that thoracic area, those long strap muscles of your back. And just start off keeping your spine quite neutral when you're doing it, and you're just getting the nice myofascial sort of release through there.
For people that aren't familiar with lumbar versus thoracic, where is the bottom of the thoracic? Where should we be stopping?
So the thoracic spine is where your ribs attach. So you've got 12 thoracic vertebrae and all of your ribs come off them. So as soon as you sort of feel like your ribs are quite angled, so as soon as you feel like where the apex of the ribs goes to, that's your thoracic spine. You just don't want to be sort of hanging over the roller through your lumbar spine. It's just not a very safe position. Whereas through the thoracic, once you loosen it up, as we are doing, then you can sort of put your bum on the ground and then you can lay over it and sort of specifically do segments. So you might lay back and relax as long as there's no pain. Take some nice easy breaths. If it's too hard with your hands there, you can support them on the ground, but I think it's a nice spot to support your head if your hands are on your head. And I usually just hang out in each spot for 4 or 5 breaths till it feels like it's releasing, and then you just might move the roller up one level, which is about 2 or 3 centimetres, and then just lay back again, trying to promote extension through your upper thoracic spine. Nice easy breaths. Good, one more up, a bit higher. If you wanted to continue through the thoracic spine, you can do a few little stretches after that are quite effective. So you can do your sort of rotation type movements on your side. You could do, I don't know what's called in yoga, but this is mermaid in Pilates.
Mermaid in Pilates, yeah.
What's that in yoga? What's that called?
It's actually a yoga pose. It would just be a seated side stretch.
Okay, so you could do that. Now that you've loosened this up through your lats and your cuff, you should feel like you can do a little bit more movement there. Breathe up push your armpit towards the ceiling. Make sure this shoulder's not coming up to your ear. You want it to have length through the side of your neck, and then just go up and over, and then breathe. You should feel a nice side stretch for that right side. So 3 or 4 breaths there. Good. And cartwheel out of it. Swap sides. Length through the right side, up and over. Pushing your armpit towards the ceiling. Just nice, easy breaths. Expanding. Try to expand your ribcage out to the side. So you want to do it laterally, so you're really flaring your ribs out to the side to promote stretching between the ribs. More breath. Come out of it. And then last of all, I'm just going to, like child's pose position, this will just promote a bit of, again, thoracic extension and shoulder range. And just use the roller just to gently go out. And it just allows you to fall down a little bit lower. You can feel that through your cuff, and maybe even through your armpit a little bit if you're stretching. Again, just be careful if you've got any shoulder problems and you're feeling any pain on top of the shoulder. This is a position to avoid, but if you've got good movement, it's a good way to get a little bit more shoulder range of motion above your head. One more breath. And just slowly roll out of it.
Thank you, Ryan. If you have any questions, or if you want to see more stuff from Ryan, just comment below this video, and enjoy your foam rolling session.
See you guys.
Nailed it.